Right, we're starting now our discussion of the third type of blood vessels that we have in the cardiovascular system, and those are the veins, and we classify those two into two main types. Those are small veins, or the venules, and the actual veins. Starting first with the venules, those are very similar in terms of structure to the capillaries. They consist primarily of endothelium and few pericytes. And as they move away from the capillary beds, they will become larger by gaining one or two layers of smooth muscles. Veins, those are going to be the capacitance vessels. And why do we call them the capacitance vessels? Because they act here as a blood reservoir. If we're looking on here at the distribution of the blood in the different parts of the vascular system, we can notice that the systemic veins will be holding 60% of the blood volume at any time, compared to the pulmonary vessels and the lungs will be holding only 12%. The heart itself in its chambers gonna be holding 8% of the blood volume. Arteries will be holding only 15% of the blood volume, and the capillaries will be holding just 5%. What allowed the veins to become the capacitance vessels to hold most of the blood volume is that they have, as you see, a much larger diameter, which will enable them to contain large volumes of blood. Also, they have a very low resistance and very low pressure. Remember, the wall of the vein is much thinner than the wall of the artery. They contain less elastic tissue, they contain less muscle layers compared to the artery. So this creates a vessel with a much lower pressure and with a larger lumen, which will be a suitable place for the blood to remain in. So if I am under lower pressure, I don't want to move from a low pressure to a site with higher pressure. So again, having larger lumens compared to the arteries, this enables them to become the capacitance vessels. Remember, those veins will have valves in order to prevent the backflow of the blood, as they have a much lower blood pressure. If we're looking at the systemic blood pressure, again, the systemic blood pressure is created by the blood flow against the resistance, which is the friction with the wall of the vessel. The highest pressure is going to be in the elastic arteries, in those large arteries. During ventricular contraction, systolic pressure is going to be around 120 millimeter mercury. And during ventricular relaxation, diastolic blood pressure is going to be around 80 millimeter mercury. As you keep moving away from the large arteries, away from the left ventricle, the pressure keeps dropping. But if you notice on here, this is where I've got the fastest decline in my systemic pressure, in the arterioles. Remember, why in the arterioles you get this major drop in your blood, in the blood pressure? because they are the resistance vessels. They have a very high resistance, and this what will cause this major drop in the blood pressure when it gets to the arteries. You see, capillaries will have a pressure between 25 to 15 millimeter mercury, 30 millimeter mercury maximum. Venules will have a much lower pressure, eventually keeps dropping until you get to the right atrium where you get a pressure closer to zero pressure. In the arches, we're looking at three different pressures. We're looking at the systolic pressure. And again, this is the pressure exerted by the blood flow on the wall of the artery during ventricular contraction. This is what we mean by systole. The diastolic blood pressure or diastolic arterial blood pressure is going to be the lowest pressure in the artery, and this is going to be taking place during ventricular relaxation. The third pressure is the pulse pressure, and the pulse pressure is the difference between systolic pressure and the diastolic pressure. So if you are touching one of your arteries, you will feel a pulse. What is this pulse that you're feeling? What is it that you're feeling? You're feeling not the blood flow, not the blood pressure. What you are actually feeling is the change in the blood pressure, the variation in the blood pressure. So it was diastolic, it was 80 millimeter mercury, and went up to 120 millimeter mercury. It went up to become systolic. So what do I feel is actually the difference between those two pressures, the difference between the systolic and the diastolic pressures. This is what we call the pulse pressure. So if I told you a person has atherosclerosis in his large arteries, so he got a high systolic blood pressure. So let's say in here, he has a systolic pressure of 160 millimeter mercury, and he almost has a normal diastolic pressure, which is 80 millimeter mercury. What's going to be the state of his pulse? Will it be stronger than normal or weaker than normal? What do you think? Stronger. Why stronger? Because what I feel is the difference between systolic and diastolic. And what is the difference between systolic and diastolic here? Is equal to, it's equal to 80 millimeter mercury. This is the pulse pressure. How about normally? Normally it's the difference between 120 and 80. What do I feel is 40 millimeter mercury. So the pulse itself is 40 millimeter mercury. Normally, a person with atherosclerosis in his large arteries, he will have a higher systolic pressure, and as a result, he will have a much greater pulse pressure. And pulse pressure is the difference between systolic and the diastolic pressure. So if you're conducting a study to check, let's say, the effect of a medication on blood pressure, arterial blood pressure. Which one would you consider in your study, if you're following just a single number, to have an idea about the effect of this medication on the blood pressure? Which number would you pick to monitor? Systolic, diastolic, pulse pressure. Systolic, but systolic is not gonna be giving me a picture of the average pressure. Systolic is the highest pressure I get. Pulse pressure is the difference between the two, right? But if you remember, what was the different phases of the action potential of the cardiac muscle cells? I do have depolarization and repolarization. And remember, there is a phase in the during repolarization in which I will have a plateau, right? So remember how your cardiac muscle cells are going to respond to depolarization. How your cardiac muscle cells are going to respond to depolarization. Again, my question, how my cardiac muscle cells are going to be responding to depolarization? They will contract. And how would they respond to repolarization? They will relax, right? This is what we've learned. So when I depolarize, the muscle will contract. When it repolarizes, it will relax. So if I'm looking here, let's say this is 1 second where contraction relaxation will take place, like this. 1 second, contraction and then relaxation. So during the time, what is the time for the contraction compared to the time of relaxation? Would the cardiac muscle cell spend more time contracting or spend more time relaxing? What do you think? Relaxing. So I'm spending almost double the time to relax than to contract. So it's a ratio of 2 to 1. So while I contract, what was the blood pressure in my artery is called? When my ventricles are contracting, during contraction, during ventricular contraction, what is the blood pressure in my arteries? It's my here we go, systolic. And what was the blood pressure in my arteries during ventricular relaxation? Diastolic. So which one gonna be taking longer? Systolic pressure or diastolic pressure? Which one is gonna be longer? Diastolic. It's almost double the time of systolic, right? So I can't just consider systolic. I can't just consider diastolic. I can't even consider only the difference between the two. I want something to give me an idea about the average blood pressure all the time present in my arteries. So we're gonna be considering in this study something that we call the mean arterial pressure. What is the mean arterial? Mean means it's the average pressure. Average pressure. But I want to consider that systolic blood pressure is only present in 1/3 of the time, compared to the diastolic pressure is going to be present in 2/3 of the time. So if I'm considering here, so 1/3 of the time, I will have systolic blood pressure. And for 2/3 of the time, I will have diastolic blood pressure. So this gives me the average pressure present all the time in my artery. If we're looking here, pulse pressure was equal to the difference between systolic and the diastolic pressure. The difference between systolic and diastolic, it's the pulse pressure. So what we're going to do, I want to check here. Systolic pressure is simply going to be the pulse pressure plus the diastolic pressure. So if I'm saying here 40, systolic pressure is 120, and diastolic pressure is 80. So you can say 120 minus 80 is equal to 40, or you can say 40 plus 80 is equal to 120. It's the same. So I will substitute the systolic pressure on here by pulse pressure plus diastolic pressure. And we're gonna be multiplying 1/3 on here. It's pulse pressure and plus 1/3 of the diastolic pressure plus 2/3 of the diastolic pressure. So 1/3 diastolic, 1/3 systolic, 1/3 diastolic, 2/3 diastolic is equal to 1/3 plus 2/3. 1/3 plus 2/3 is equal to is 1, right? So the average pressure is simply diastolic pressure and the difference between the diastolic and systolic for 1/3 of the time. All right, this is my mean arterial pressure. So again, how to calculate the mean arterial pressure? Mean arterial pressure is equal to diastolic pressure plus 1/3 of the pulse pressure. All right. Any difficulty? Moving on to the pressure within the capillary. Capillary blood pressure is going to be between 15 to 35 millimeter mercury. Why is a low blood pressure in the capillaries is desirable? Why do you want to keep this low blood pressure? Why don't you increase the blood pressure to get better exchange to take place? Because first thing, they are fragile. They will break. They can't tolerate greater pressure. They are thin-walled vessels. They are fragile. They will rupture if they got exposed to higher blood pressure. The one thing. The other thing is that you don't actually need to increase the pressure in order to get better exchange. You're going to have the type of capillary that will fit your needs. If you remember, if I want to have a minimal permeability, I keep continuous capillaries, skin, brain, and muscles. What if I need greater permeability than the continuous capillaries? You're going to have fenestrated capillaries like intestines, like in your kidney, like in the endocrine glands, so greater permeability. What if I want much greater permeability than the fenestrated capillaries? I need cells to move in and out. I need huge chemical compounds to move in and out. You're going to have a type of capillaries that fits your needs, which is the sinusoidal capillaries. So you don't want to increase the pressure to allow better exchange, because you're going to be performing the amount of exchange that you need in this organ according to the type of capillary. Additional pressure will not make any difference in terms of allowing better exchange to take place. Moving on to the venous blood pressure, and the venous blood pressure is the lowest in compared to all the other parts of the systemic vessels. It has very minimal change during the cardiac cycle. So if you notice on here, on this graph, in the arteries, there was a major difference between systolic and diastolic, 120 to 82. I did have a pulse of 40, pulse of a pressure of 40 millimeter mercury. But if I keep moving away towards my veins and my venules and veins, you'll see a single line. There is no major difference between systolic and diastolic. No major difference. So if you put your finger on veins, they don't have pulse. Why they don't have pulse? Because there is no difference between systolic and diastolic. The pressure is going to be around 50 millimeter mercury, and as you keep moving towards the right atrium, this is going to be going down. So how come I have that low pressure and still able to conduct the blood against the gravity from my leg veins, for example, to the right atrium? So I have a very long column of blood that I need to move against the gravity, against its weight. I have two major pumps on here. First is going to be the muscle pump. So if I'm looking here at the vein, my leg veins are surrounded by muscles, and those muscles, when they contract, remember, a muscle contraction is a shortening in the length of the muscle, but in the same time, what's going to happen here, they will be bulging out like this. So as they bulge out, they will be squeezing the vein. And remember, when I reduce the diameter, when I squeeze the vein, what happens to the volume inside those veins? When I squeeze the vein here, what's going to happen to the volume? Decrease the volume. And as I decrease the volume, what happens to the pressure? Can you remind me? As you decrease the volume, what happens to the pressure? Increases. So I have an increase in the pressure. So the blood at this point gonna have higher pressure. It wants to leave. I'm creating a point of high pressure. So the blood is either gonna go up or down. Because up I have lower pressure. If I go down, I have lower pressure. But remember, veins, they do have valves. So if the blood is gonna be trying to move down, the valves will close, preventing the backflow of the blood. So the blood won't be able to move down. It can only go up. So it will keep moving up towards my heart, towards my right ventricle. This is the first pump. This is my muscular pump. The second pump is the respiratory pump. If you remember, the lungs are kept in your chest, in the thoracic cavity. And if you remember, the lungs were surrounded by a serous membrane. We call this serous membrane is the pleura. The serous membrane did have two layers, a layer that is attached to the lung tissue, and another layer that is lining the thoracic cavity from inside, like this. So we call this one is my visceral, and this one is my parietal layer of the pleura. When you breathe, your lungs are going to be inflated. But your lung tendency, will it be to expand or to recoil? So if I had got a lung and I'm not pulling air into the lung, would this lung expand on its own, or it will try to collapse? What do you think? What is the tendency of the lung? Is it to expand or to recoil? It tends to recoil. So it's all the time going to be trying to deflate, right? And recoils. So what's going to be the tendency of this visceral layer of the pleura? This one. It's going to be trying to move in or out. It's attached to the lung. The lung is trying to collapse all the time. So is this visceral layer is going to be trying all the time to move in or trying to move out? What do you think? It's pulled by the lung, it's attached to the lung is trying to move in all the time, so the visceral layer is going to be trying all the time to move in. compared to the chest. Chest wall has muscles attached to the ribs, and the chest wall tends to expand, to move out. And again, what is the layer of the pleura that is attached to the chest wall? It's my parietal layer. So the parietal layer also gonna be trying to move out. So I've got two layers of the pleura. One layer, which is a visceral layer, it's gonna be trying to move in because it's attached to the lung tissue. The other layer of the pleura, the parietal layer, is attached to the thoracic wall, the insides of the chest. And the chest wall tends to expand, tends to move out. So the parietal layer is going to be trying to move out, away from the lungs. So one is trying to move in, one is moving out. So I'm creating a vacuum in between. And a vacuum would be pulling or pushing. What do you think? Do you have a vacuum machine? Does it push or pull stuffing? It pulls, right? It's not a blower. It has a suction force. So here I have a suction force created. Every time I'm breathing, I have vacuum created between the two layers. The two layers are trying to move away from one another, and it's sealed. It doesn't allow air to move in between the two layers. So I'm creating a vacuum. This vacuum is located where? In my chest. And what else other than your lungs is located in your chest? What else other than your lungs is located in your chest? Your heart. So you have vacuum surrounding the heart. This will create a suction force that will allow you to pull the blood up back towards your heart. So what do we call here this pump? It's my respiratory pump. Respiratory pump is the effect of breathing. So I'm breathing, I keep moving air in, so this increases the tendency of my lungs to collapse and recoil, and increase my chest tendency to expand, creating more vacuum that pulls the blood up towards my heart. So let's see here. A 60-year-old male came to the hospital with his daughter. Or 70 years old male came to the hospital with his daughter. His daughter told you that he went to the restroom and all of a sudden he fell down on the floor early this morning. So how do you explain what happened to this guy? So what do I know? What do I know? I have an old male, 70 years old, and he went to the restroom and he lost consciousness. This is what I know. How do you explain what happened? Why is this guy did lose consciousness? Any guesses? Straining too hard. Straining too hard. How do you strain? You're closing the vocal cords. You're not allowing air to flow out. In the same time, you are contracting the diaphragm. So the diaphragm is going to be moving up like this. So air trapped in your lungs and your diaphragm is contracting. So air is filling the lung. So it prevents the lung from collapsing. It prevents the lung from recoiling. So if the lung is not recoiling, would I have this vacuum? Would I have this space? Well, I have the space, but will it create a suction force if the lung is not trying to recoil because I trapped the air inside when I'm straining? No, I lose this vacuum. So I lose this vacuum here. And 70 years old, when you get older, what happens to your skeletal muscles? Would they become weaker or stronger? Weaker muscles. So what happens to my muscular pump? I have weak muscles. I have been sitting down. I'm not moving my legs when I go to the restroom. So the muscular pump is also going to be affected. So muscles are not that strong. He has been sitting, straining. While he strains, he is reducing the effect of the respiratory pump. So less blood is returning back to the heart. So less venous return. If I got less venous return, remember, how is this going to affect my cardiac output? You remember? Less venous return means less preload. Why less preload? This venous blood is going down to the right atrium, to the right ventricle to be pumped to the lungs, and then will return back from the lungs to my left ventricle, to the right, to the left ventricle, passing through the left atrium, and then from the left ventricle, it's going to be pumped out into my aorta for it to be distributed to the different organs, and one of those organs that will need continuous supply of oxygen, it's going to be my brain. So if no venous blood, or I have a reduction in the amount of blood returning back to the lungs, returning back to the heart, I will have less blood that will return to the left side, and so less blood that's going to be pumped out. So less blood reaching my brain, and that's why this guy did faint, did lose consciousness. Right, and this is what we mentioned when we studied the cardiac output. If you remember, I have reduction in preload, less stretch applied to the wall of the ventricle. If I have less stretch to the wall of the ventricle, what's going to happen? I have a reduction in my end diastolic volume. And if I have a reduction in the end diastolic volume, what's going to happen? Stroke volume is going to be reduced. And if I have a reduction in stroke volume, remember, cardiac output is equal to stroke volume times heart rate. So if you decrease stroke volume, what's going to happen to your cardiac output? It's going to also decrease. So less blood pumped from the heart to the different organs, and here we're concerned with the brain. And even you, when you wake up in the morning and you jump out of the bed, you stand up, all of a sudden you can feel drowsy. Orthostatic hypotension is a different story. This is a variation in the blood pressure when a person stands up compared to lying flat. It's pathological, but here I'm concerned with the physiological aspect. It's a similar concept, but it's normal. Here, this drowsiness that you experience when you jump out of bed and you suddenly stand up, you feel less that you became drowsy because of the sudden drop in the amount of blood coming back to the heart. All right, so when you walk few steps, your muscles will start to squeeze the blood. Blood's going up to your brain. You're gonna be fine in a second. All right, is this clear? Is this clear? All right, so for question number 5 for today, it's which one of those vessels gonna have the highest blood pressure? Which one of those gonna have the highest blood pressure, do you think? Capillaries, elastic arteries, veins, arterioles. Elastic arteries, aorta and its major branches. Elastic arteries, exactly. Elastic arteries, the aorta and its major branches. This is where I've got the highest blood pressure. So if you remember, what creates the blood pressure? Two major factors. First one, you've got blood flow. And this flow is faced by a resistance, this friction that it has with the wall of the vessel. So I have two factors in here. I have the blood flow, blood moving in the artery, and the resistance applied by the wall of the artery. So which one gonna create greater resistance? A large diameter or a small diameter? So will it be easier or harder for the blood to move through a vessel with a smaller diameter? Here. Harder or easier for the blood to travel through a small diameter compared to a large diameter? It's going to be harder, right? Harder. So this means what? This means that the small diameter creates high resistance or low resistance. High resistance. So small diameter creates higher resistance compared to a large diameter creates lower resistance. One more question. So if you are increasing the resistance, what's going to happen to the flow of the blood? What do you think? Less flow. I'm decreasing the flow, so less blood gonna be traveling. But what happens to the pressure? How fast is this amount of blood gonna be traveling? Will it be traveling faster or slower? So if you have a hose and you squeeze the end of the hose, you are reducing the diameter. Would the water come out faster or slower? I'm not talking about quantity. I'm talking about speed. Squeeze the end of the hose. What happens to the water? Water will be traveling faster, create at a higher pressure. So having higher resistance, how this will affect the pressure? Higher resistance, how will it affect the pressure? What do you think? If the blood faces higher resistance, it's gonna have greater pressure. Smaller diameter creates higher resistance, resulting in higher pressure. All right? So if I'm telling you here, your brain did detect that you have an increase in your blood pressure, how do you think you're gonna be responding? Would you constrict the vessels or dilate the vessels? We're talking here generalized. Most of the vessels in your body are gonna be responding. Would you like them to constrict or to dilate? What do you think? If you already have a high pressure, if you already have high blood pressure, would you like them to constrict or to dilate? What do you think? Remember, if you constricted the vessel, this creates higher resistance. Higher resistance means higher pressure. So if I have high blood pressure, how would I respond? I will be performing a vasodilation. But if I have low blood pressure, the water pressure coming out of the hose is not allowing the water to reach all the way till the furthest point in your backyard. So what you're gonna do, you squeeze the end of the hose. So the same concept. I have low blood pressure. I want this blood to be delivered to all the organs. So what will I do to my vessels? Dilation or constriction? Constriction. So having low blood pressure, how my body gonna respond? It's gonna be performing a vasoconstriction. All right. Is this logical? Is this logical? So what do we call the resistance created by all those arteries that I am traveling through? We call this is my total peripheral resistance. The total resistance of those arteries is what's going to be affecting my blood pressure. How about the flow? Is it important to have flow or not? If I don't have any blood flow, would I have any blood pressure? If I don't have any blood flowing in the artery, would there be any pressure in the artery? No. So what would I consider as blood flow? We decided that we're going to consider here the flow of the blood that gets pumped out from the ventricle per minute, which is, in other words, the cardiac output. So in order to understand how do we regulate the blood pressure? We need to understand first what are the different factors that are affecting my blood pressure. And the two main factors on here, those are the flow and resistance. What is the flow? It's my cardiac output. What's the resistance? It is the resistance applied by all the arteries all together. They are creating a resistance that we call the total peripheral resistance. A third highly important factor is going to be the amount of blood, the blood volume that I have. So three important factors here that will be directly affecting my mean arterial pressure. Those are the cardiac output, total peripheral resistance, and the blood volume. All right. Questions? All right, so this completes our discussion for today. We're going to keep the discussion of the different regulatory mechanisms of the blood pressure to start with our next session. Any questions? All right, so please let me double check it now. All right, so can you Kazi, can you please stay after for me to check with you the issue with the Canvas message. All right. All right. For the rest of you, have a good night, and we'll see you on Tuesday. Please write down your first and last name before you leave. Now, the first three questions, you're going to answer them separately from your assignment. So the assignment, this was the in-class activity for last class. Those three on here, those are for today's activity, right? The whole thing is part of the last class activity, but those three are part of my in-class activity for today. All right. Thank you so much and have a good night.